Hello, hello. Hi, guys. Okay, so I am bright tonight. Did they update the Facebook settings? Okay, so I just exfoliated. That's why I'm really shiny and all amazing. So tell me if this is working. Drop me a 1 if you catch it live and a 2 if you catch the replay. And feel free to share it if you'd like. We're going to be talking about LANAP and what it is, and while we detox and dental talk. So while people jump on, tell me hi. I'm going to go ahead and put my mask on. Hey, Michelle. Happy birthday, Eve. Hey, Curbs. Yes, I have another sinus infection, hence why I am getting surgery at the end of this month. If it does not help this, I'm going to scream. But this is actually more normal for me. So my throat would hurt and then it would move up to my head and then into my chest. So this is more normal this go round than the last one that turned into an ear infection. What? Who gets ear infections? Hey, Brianna. And on the same day I got a sinus infection, Aunt Flo showed. Anybody else visit them that they didn't want to hang out with? Anyway, so this is my favorite time of the week because I love dental talk and I love this mask. So let me get my skin right. Y'all, let me just tell you one thing about skincare before we talk about teeth. Too many people give up on skincare because they try a new product and their face breaks out, or they try a new product and they get a bump or 3 and they try it for like a day or a week. You've got to give skincare a solid 3 to 6 months, okay? Just because your face does something funky the first time you use it, as long as it's not like an allergic reaction, you've got to keep going. Sometimes your skin has to purge before it gets better. Hey, Summer. Hey, Summer. Hey, Sierra. Lots of S's on tonight. Hey, Starla. Thanks for sharing. Hey, Miss Deborah. Okay, so enough about skincare talk. Let's just get right to the picture because who's going to be my timer? At 7 minutes, tell me. Look, you can see where I really needed it. Something about this mask gives instant gratification. Okay, so, yes, I can't breathe. If I start having snot roll down my face, I apologize, whatever. So let's talk about LANAP. So in our office and maybe some other offices, LANAP is a laser treatment procedure for severe periodontal patients. You know, back in the day when you had it's been 7 minutes already? Oh, you're going to count down for me. Okay. I was like, God dog. Hey, Crystal. Okay, so a lot of people that have severe perio, back in the day, if you had to have surgery, they would take your gums, they'd flap it, clean it all up, stitch it up, sometimes even do like grafting and stuff like that, okay? Sounds kind of like the olden day sinus surgery where they'd like take your nose and open it and clean it, but now they have hopefully a lot better procedure because I'm getting it done in a couple weeks. But I brought this booklet. So this is a booklet that we use at our office. They're going to jump on and be like, you took that from us? Hey, Shannon. Anyways, so I'm going to kind of explain to you basically how there's no cut and sew. So most dentists should be heading towards the laser route if they're keeping up with times and, hey, Heather. Hey, Shannon. Y'all, sometimes when this fizzes, it tickles me and it makes me want to scratch. Hey, Christina, you're detoxing. It's the best. Hey, Joni. Okay, so laser treatment. I'm trying to make sure I don't get it on my robe. Y'all know I live in this robe. It's my favorite. Hey, Yvette. Hey, Heather. If I knew it would stay closed, I'd probably only wear it. It's just like the best robe in forever. I mean, in the world, actually. I was going to say Texas, but really the world. Laser treatments is an advanced technique to treat periodontal disease, like gum disease, okay? And it actually can help regrow bone. So back in the heyday, we were always taught that you can never regrow that bone back, that you can maintain it, keep it cleaned. But this procedure, I should have brought my water in here because talking and having a sinus infection, hey Kara, hey Jennifer, is a little bit more up to date. Hey Kendra. And it's a laser light that's used to gently remove harmful bacteria and disease from the gum pocket. So what they do is you're numb everywhere and they actually clean off all the tartar, but they char off, like basically just gut off the dead tissue. Okay, and I'm gonna show a picture so it makes sense. So that the new tissue will kind of reattach to the, hey Lisa, hey Paula, to the tooth, okay? So it's dramatically less traumatic for the patient. It's very highly effective. No cutting and sewing. It preserves gum tissue, reduces root exposure and sensitivity, reduces infection. So a person who's a good candidate for this is somebody who has areas that are like really deep. And I'm not going to use technical terms because you won't really know, but I would say people with 5 millimeters or greater could benefit from it, but 5, we can kind of sometimes reverse it back down to 4 or 3s. I would say 6s or higher is pretty, thank you. Actually, my throat doesn't hurt today, so I'm okay with that. I'm pretty used to these sinus issues. But let me show you these pictures, okay? So this is a good diagram. So this is the tooth, right? And see how the probe measures a pocket? Ultimately, you want your gums to be attached like all the way up to here. So it went down like a ton of millimeters, right? Hey, Brittany. And what the laser does is it comes through and see this imaginary line? Okay, so this hump right here is tartar. So what happened is plaque got underneath the gums because this person didn't floss, and it just slowly over time grew and grew because more plaque stuck to it, and now it's irritated the tissue. Pretend you have like a splinter in your finger and you know how it hurts. So when you have tartar on your root, it irritates the tissue, right? See how it's irritated? It's like, get off me, pulls it away, more bacteria gets in there. So the laser comes through and just literally cleans off the dead tissue. And see how the tissue right here is gone in this picture? So they clean it off, they get the tartar off, okay, while you're all numb. They use the laser to sterilize the pocket. See, this is the bone right here. See this guy? The bone's all infected right there. See, it's not happy bone. They use the laser, and now it's in my face. I can't even see what I'm doing or showing y'all. And then over time, it grows back up to the tooth. Look at that. And then you have happy bone. Okay, so it takes about a year. We don't even go below the gums, hey Chastity, before a year to measure or check or anything. We'll clean and make sure everything stays healthy. You got to be seen every few months. But ultimately, we've had really good results with our patients that like thought they were going to lose their teeth to mobility and all kinds of stuff. So the procedure itself is virtually painless. You're definitely numb just for comfort, and it can take a little while. It doesn't take that long, but it's just such a good alternative. So if you need perio surgery, find a dentist that does this procedure. And my time is officially up, so I'm gonna wipe my face off. But let me see if there's any more information I wanna give y'all on another thing we do with our LANAP patients is if they need to have splinting because their teeth are mobile, we'll splint them together so that they have more stability. But also we get an occlusal guard, and that helps keep teeth safe, guys. If you clench or grind, which guarantee almost every single one of you on here does one or the other, whether you know it or not, you need a night guard. Hey Roxanne, hey Kristen. Yes, floss, floss, floss. If I can get anybody to floss every night before you brush your teeth, oh my God, it's a changer. So anyways, there is like diet instructions afterwards, and the worst part about it is you are not supposed to brush your teeth for like the first 10 days, I think, following procedure. So I know it sounds awful, but yeah, it's awful. But you can rinse with like this medicated mouthwash. Anyway, it's totally worth it though to save your teeth. So I'm gonna take my mask off and finish my skincare. But ultimately, I really just wanted to come tonight on Detox and Dental Talk and talk about this laser perio treatment versus traditional and how it's totally amazing. So go floss your teeth and floss them and brush them tonight, and Brush them every morning, and don't forget your tongue, guys. A lot of people forget the tongue. So, thank you for hopping on with me. Don't forget, if you shared this, tell me. You could share it because somebody out there has gums or teeth that they need to save, and I try to help. So, hey, Melissa. All right, guys, y'all have a good night.